normal microbiota and prebiotics. In this lecture, we are going to talk about the some definitions, and also we are going to learn more about the three different host microbe relationships, and also what are the benefits of microbiota, and also some clinical significance for microbiota by site, by anatomical site. And then we are going to finally talk about the probiotics and prebiotics. Okay? So first we start with some definitions. So what are microbiota? Well, actually this is a recent term for the normal microbial flora. Okay, so it is just normal flora, but this is a relatively recent term, microbiota. Okay, so we have different the other term that you have to know also is the microbiome. The microbiome is the collective genomes of the microbiota in a human. So it's just the genetic material of the normal flora we have in a human. Now we have two different terms, resident microbiota and we have transient microbiota. So what
دكتور العفو ماكو عرض لو انت ما مسوي عرض؟
لا ماكو. هنا المحاضرة راح تجيكم برنت ماتيريال راح اسويها على المنصة، فهذا فقط يعني شرح، وانت راح تاخذ المحاضرة وتقرأ بها.
تمام، شكرا دكتور.
عفوا. So these are the terms. So we have resident and we have the transient. The difference is that with the resident, they are relatively fixed type of microbiota. So they don't change as frequent as the transient. The transient is, from its name, it's just for some time. So resident is fixed type of microorganism that are regularly found in a given area, at a given site. But transient, they are non-pathogenic or potentially pathogenic. They inhabit the anatomical site for hours, days, or weeks, but no longer than the resident. Okay, so this is the main difference. Now we go to the very important topic, which is the host-microbe relationship and the three different and major relationships that we have. Actually, this topic is considered to be fundamental to understand lectures or any microbiology text that you are going to read in the future. So it's very important to learn and to know more about these three different types of relationships. So what is the first one? The first one is very simple. It is called utopia. And by utopia, we mean that the relationship is beneficial. So it's a mutual relationship, and there is a good adaptation for the microorganism with the host, here, for example, human, and they present a normal microbiota environment, and so usually it is not associated with any disease because it is the normal setting, it's the normal microorganism, normal flora that we find in a given anatomical site. Okay? Now this term is very simple to understand because this is the normal thing. There is no disease, there is no pathology. Now we go to the second type of relationship, which is called dystopia. In dystopia, we Here, the term means the presence of microbiota in unfavorable condition or in unfavorable environment in that given anatomical site. So this, of course, will lead to different pathologies, including cancer. Okay. Now, keep in mind that association between any disease or a certain microbiota doesn't necessarily mean a causation, which means that if you see a certain microorganism and there was a cancer in that patient, it is not necessary to link the cause of that cancer with that microorganism. So association doesn't mean necessarily causation. Okay, you should keep that in mind always when you read microbiology text. So now we come to the third term, atopia. Okay, atopia is actually there is a condition when you have the microbiota are eradicated either by, let's say, by any means, okay, by antimicrobials, like, or any other certain substances or chemicals, bactericidal or statin. Now, if you eradicate microbiota, there will be a condition which is unhealthy that will make the host vulnerable to different pathologies. Now, it's very important to know that these pathologies are different from the dystopia. Okay? So these are the three different and major types. Very important to distinguish them. Utopia is the normal relationship. There is no disease, no pathology. Dystopia, there is unfavorable site by the microorganism in the host, leading to certain pathologies. But atopia is, again, certain pathologies resulted from eradication of microbiota. So microbiota are important. And once they are eradicated, then there will be unhealthy new condition in that host. And the pathologies emerging from this condition are totally different from those in dystopia. Okay? So utopia, dystopia, and atopia. Don't forget these three. Now, do we have some examples? Yes, we have. For example, E. coli. You know, E. coli is a normal flora, the large intestine, and they are beneficial to humans. They are participating in or contributing to vitamin K. Vitamin K is important to humans. So these are beneficial microbiota. My E. coli is part of it. Now, if you see my E. coli in the blood, what do we call this condition? Any idea? So E. coli usually is present in the large intestine, but if you find it in the blood, is it a favorable sign? Is it a favorable environment for E. coli? If the answer is no, then this will lead to dystopia. Okay, so of course the blood is a sterile blood body fluid, and if E. coli is there, then we have bacteremia or even septic infection maybe, and this will because E. coli is now present in unfavorable condition. Now, imagine that E. coli is now eradicated because of the antimicrobials administered to that certain individual. What would happen? The E. coli then will be eradicated and there will be imbalance of the microbiota leading to different set of diseases. So if vitamin K will be affected and other protective effects of E. coli and the balance provided by this microorganism will be lost. So this will give us another set of pathologies, which is different from dystopia. Now we go to the importance, because microbiota are so important actually in the human. So there are some benefits, of course, for these microbiota. Actually, these are considered part of human health. So if microbiota would be lost because of eradication or any therapy, then all these benefits will be also compromised. Now, for example, what are the importance or benefits of microbiota? For example, synthesis of some metabolic elements. And in the intestine, as we said, E. coli is contributing to the synthesis of vitamin K. Also, they contribute to these short-chain fatty acids, and that control the intestinal epithelial cell differentiation. So very important. They contribute to biotin, folate, and aid in nutrient absorption. So these are all benefits provided by microbiota. And they also assist in metabolizing dietary carcinogens, okay? And they assist with fermentation. So sometimes when there is some kind of non-digestible dietary residue, they will assist in fermentation, okay? So these are benefits. Another benefit is that they prevent colonization by pathogens. So they contribute to protection of the host from pathogens and by what is called the bacterial interference, okay? So this also is very important. And so now, even now, evidence that the microbiota can influence fat deposition that leads to obesity. So obesity can be part because of the microbiota imbalance. And whenever there is eradication of a certain microorganism, what do we expect? Now we expect its balance will be lost, and leading to a pathology. And finally, they play also a very important role in maintaining a proper immunological response. So they contribute, for example, for the secretion of immunoglobulin A, and also play a very important role in immunomodulation, okay? So if you came across maybe for the topic of immune modulation, there is like T helper 1, T helper 2, and the T helper arm of immune system, the cellular, and they can play a role in shifting the immune response from one axis to another, okay? So this is very important. Now, some numbers that you should also be familiar with in microbiota. There is here very important that the number of microbiota or bacterial cells, okay, is about 10 times more than the cells of the human body. So now the question is, what do you think? So which is more in quantity? The human cells or bacterial cells, the normal flora? Okay, so of course, the normal flora, the microbiota is 10 times. Now, the other thing is about microbiome, which is don't forget, the microbiome is the genetic material, okay, the genome of whole microbiota in a certain individual is about 150 times, 150, imagine that it is 150 times larger than the human genome, okay? And the total number of bacterial species in the normal healthy bowel is about, or more, exceed more than 1,000 species, okay? Now, 30% of all bacteria in the gut, they belong to the genus Bacteroides. So Bacteroides is a major component of the microbiota in the gut, okay? And the biomass, the mass, okay, how much does it weigh? The biomass of gut microbiota will reach about 1.5 kilogram. Can you imagine 1.5 kilogram? This is about an organ. So therefore, they call the microbiota, as they call it, the forgotten organ, okay? The forgotten organ. Just because you don't see it, that doesn't mean it does not exist, okay? So now my question to you, dear students. So knowing all these things and numbers, what do we think? Who lives inside whom? Do microbiota live inside us, or do we live among them? What do you think? Please, you can answer in the chat box. Do we live among microbiota, or microbiota live inside us? I mean, which is more? Which is more in number? Okay, you can answer this in the chat box, please.
دكتور العفو، يعني
Yes.
يعني هو هل يعتمد على النمبر حتى نقول هيجي لو
It is,
يعتمد على
it is just from the number. It is just from the perspective of numbers. So just imagine that we are just harboring that very huge number of bacterial cells. And if you are sitting like in a room, about 100 students, imagine that. And now we count the microbiota, every single bacterial cell in that room. So which is more in that room? Do we live among them, or do they live inside us? Which is more accurate?
ما أعرف صراحة يعني.
Because their number is largely exceeding ours, so we can safely say that we live among them. They are more in number. This is very important. Now, therefore, if you are now trying, if you think that you are going to eradicate, or you administer some micro or antimicrobial or any chemical substance that will kill the microbiota or normal flora, then there will be, you are like doing eradication and for a large number of cells. Now, every single cell has the ability to acquire resistance. Therefore, it is not surprising to see a growing rate of resistance of antimicrobials all over the world, because of the huge amount of bacterial cells that are acquiring resistance to antimicrobials. And this is actually the growingly important major health problem, okay, to deal with the resistance. Just because there are more in number and they acquire resistance. And so attacking microbiota is attacking a larger number of cells will actually have some effects and consequences. So we have to think we have to think twice before administering antibiotics to any patient because of these facts, okay? Now, we go to another thing in this lecture, which is the clinical significance of microbiota by site. We will go like for giving some examples. For example, in the skin. Now, in the skin, there are some mechanisms that will eliminate the microbiota that do not belong to the resident microbiota, which could be very well pathogens. So what are these mechanisms? In the skin, low pH, okay? The presence of fatty acids in sebaceous glands, lysozymes, all these mechanisms provided in the skin to do that same thing, to protect your skin from non-resident microbiota. So whatever microbiota you have in the skin, actually, they are adapted to the low pH. They are adapted to the presence of these fatty chains or fatty acids. Now, my question, if you take a shower, okay, you take a shower every day and then every day now and then, you are going to the shower and then with the soap and you scrub your body. Now, the question is, can we find microorganisms or microbiota after that vigorous, or let's say shower, or taking that shower with vigorous rubbing of your skin? Do you expect to find microorganism after that? What do you think? You can write in the chat box or just open your mic and talk.
دكتور نعم أظن أنه نبقى نلقى يعني.
Okay. Why? Because you are doing scrubbing. Actually, you are mechanically removing all kinds of microorganisms on the surface of the skin. So let's say you are scrubbing your let's say dorsum of the hand, and now you are doing that scrubbing very hard. So you are mechanically actually removing everything. So why do you think that some microorganism should after that stay or be on the skin again?
يعني دكتور
Right after the shower.
يعني مثلا اكو مكان مثلا ربما هي يعني الجلد هو مو فد سطح املس، يعني يجوز في مكان مثلا يعني يعني هو مو سطح املس. هذه فكرتي الاولى. وهي بكتيريا واحده كافيه انه تتكاثر، ويعني اقدر اني القى بعدها.
Okay, now the answer to this question is simply because this is has something to do with the term resident. In the skin, the microbiota, they can still be found, but where in deeper parts in sebaceous glands. And these deeper parts you can never reach by that scrubbing. So these will repopulate, regrow, and they constitute the normal flora back again. So you'll have like the same microbiota that you did before the shower, okay? So every single individual has a certain profile of microbiota in any given anatomical site. And scrubbing won't affect that profile after taking the shower, okay? This is the answer to this question. Good. Now, all right, we go to now. Sometimes it's very important to notice that in certain infections, we see mixture of microorganisms. So, for example, we see Pseudomonas with Acinetobacter. They are increasingly common among subjects with wounds and severe burns. There is some kind of association between microorganisms with certain infections. Now, how about the role of microbiota, let's say, in dental caries? Now, we go to the mouth now, leaving the skin. In the mouth, we have dental caries. So what is dental caries? تسوس أسنان, okay? So the three things that they contribute to the dental caries. First, you have to have a teeth, okay? Or a tooth, actually. You have to have a tooth. Without teeth, there is no caries, dental caries. Good. The second thing is what? Is food residues. And food residues will be digested and fermented by microorganisms, giving rise to acidic products, end products. And the acid effect will do some demineralization of the teeth. Okay. And the third thing that you have to get caries is the microorganism, microbiota. So the microbiota, they can play a role in dental caries. Okay? And we have different types of microbiota. For example, we have Streptococcus mutans is considered to be the major organism for initiation of dental caries. And dental caries is actually nothing but disintegration of the teeth, beginning from the surface and progressing inward in different stages. So you can have dental caries if you eat or drink some acidic food or drinks and directly going to the teeth. Then there will play a role in disintegration. The other pathway is that you have some food residues left between your teeth, and these are going to be fermented by microbiota, leading again to acidic end products, again contributing to dental caries. So therefore, to prevent dental caries, it's very important to remove microbiota. This is usually done by having mouthwash, right? And also by removing food residues regularly. And this is done by teeth brush. Okay, so why do you teeth brush your teeth? Why you brush your teeth? To remove food residues. And why do you have mouthwash? To remove microbiota or microbial cells, because these cells contribute to fermentation. And you should also keep in mind to avoid direct exposure of the teeth, of your teeth, with acidic food, acidic drink, okay? This is also very important. Now, in the lecture, some microorganisms are mentioned, as also some terms for related to that topic of dental caries. Now, we go to respiratory tract. In respiratory tract, except for small bronchi and alveoli, all other parts of respiratory tract are inhabited by microbiota. So small bronchi and alveoli considered to be sterile sites, okay? Now in GIT, in the stomach, we have what is called the acid barrier. This is very important, the pH in the stomach. Usually this will keep the number of microorganisms at a certain level, okay? And allowing only microorganisms that can adapt to this harsh environment, pH environment. And one of these organisms is Helicobacter pylori. So what do you think? If microorganism is adapted to a certain environment, what do we call this relationship? If you still remember at the beginning of this lecture, we just mentioned the 3 different types. If H. pylori is well adapted to the acidic pH. So what do we call this relationship? Any idea?
Mansell?
We have 3, utopia, dystopia, or atopia. What do you think?
Utopia.
Actually, exactly right, totally right. Yes, so it is a utopia condition. It's a utopia type or a type of relationship that belongs to utopia, okay? Now, what happens if you remove Helicobacter pylori? What kind of relationship we are going to get?
Dystopia.
Atopia, okay? And they found that in certain countries where eradication of Helicobacter pylori was initiated and promoted in children, they noticed that these children developed different types of pathologies. They are not related to the gastric cancer or gastric, no. It was related to obesity, to having allergy, to having some immunological pathologies. So this is all because of the change in the microbiota, okay? So this kind of relationship, we call it atopia, okay? Now, Helicobacter pylori lives and adapted in a certain way to live inside the stomach, and the stomach should be a healthy one, and a healthy stomach includes also a healthy mucosal surface. Now, what happens, for example, if you smoke, okay, and if you have, or you drink, and these mucosal sites will be affected. Now, if your mucosal is damaged, what do we call now this environment? Is it favorable or unfavorable now for the H. pylori?
Unfavorable.
Unfavorable. So what do we call this relationship now? We call
Dystopia?
it dystopia, exactly. So now H. pylori will be part of different pathologies than we have seen in atopia. Okay, so this is very important to understand the different diseases, pathologies resulted from any microbial infection. You can apply these types of relationship to any microorganism if you are going to read any microbiology text in the future. It should be helpful along the way with topics like that. Okay. Now, for example, if you are going to introduce antacids, okay, antacids, and these are also H2 receptor blockers or antagonists. So what are you going to do with the pH of the stomach? You are going to what? To elevate the pH, right? Because you are blocking the acid secretion. Now you are changing the environment in some way. You are making it unfavorable to the normal microbiota, which is H. pylori. What you are doing here, you are doing actually leading the condition to the dystopic relationship. And this will end up with a different pathology. So sometimes you start to treat a pathology leading to another pathology just because you are changing the normal environment. You are changing the healthy, the natural environment. So the physician should be very careful with what he prescribes to the patient, whether antimicrobials or antacid or any drug or therapy that it will interfere in any way with the normal or healthy environment of the patient or individual. So this is very important. Now, usually also we know that the administration of antimicrobials and usually the undisciplined administration, had and is and will always lead to different pathologies because of this atopia. And this will contribute also to a rising health problem of antimicrobial resistance and the appearance of superbugs in the community, okay? So administering antimicrobials should be carefully and controlled and carefully prescribed. Good. Now in the urethra, usually there is like a number of microorganisms or microbiota. Whenever we collect urine for culture, we can expect some microorganisms there. Why? Because during collection, the anterior urethra of both sexes, they contain almost the same microorganisms that appear on the skin and perineum. So if you have urinary tract infection, you have to have microorganisms exceeding the number of 10 to the power 4, okay? So it's about 10,000. So if you should have more than 10,000 in order to say it's an infection. Otherwise, it could be very well part of a normal flora. Okay, in the vagina, for example, we go to another anatomical site. We have what? A very important component is the lactobacilli. These lactobacilli will help maintain the pH, acidic pH, low pH. And this low pH, if you still remember in the skin, is protective, is protecting the vagina from other infections. So if vagina is, for whatever reason, the pH or lactobacilli is removed by administering soap or any disinfectants, antiseptics that will interfere with the growth of lactobacilli in the vagina. So what do we expect here? And what do we call this relationship? Just to remember. Yes, you can also. Yes, you can write in the chat box. So what do you call this relationship? If you eradicate or you remove lactobacilli from vagina, this will lead to mycotic infection, for example, to fungi. It will be the balance of the microbiota will be disturbed, and this balance was very important to maintain health and to protect the vagina from infections, including fungal infections, mycotic infections. So what do we call a few? For example, by soap, administering soap or antiseptics and killing the lactobacilli, the normal flora or microbiota of vagina. What do we call this relationship?
Atopia.
Completely right. Now you are doing an atopic condition, okay? But keep in mind that some microorganisms, if you still remember in streptococci, we have Streptococcus agalactiae, which is part of the normal flora in the vagina, okay? This very part of normal flora of the vagina can contribute during birth. The baby can acquire the group B streptococci and leading to neonatal sepsis or meningitis, okay? So this could be, and what do we call this condition, by the way? We know that Streptococcus agalactiae is part of the vaginal microbiota, okay? But if we find it now in the baby, is it a favorable environment for the S. agalactiae? And if it's not, what do we call this relationship?
Dystopia.
Dystopia. Thank you. Good. So now we are getting the point. So we are now understanding the three different relationships. Good. So with this, I can simply go. By the way, in the lecture, you are going to see some examples of what kind of microbiota you can actually expect to find at different anatomical sites. So this is just for information, and it's also good to mark out these microorganisms. Now we go to the final topic of the lecture, which is probiotics and prebiotics. Because microbiota plays a very important role in human health, so there were many trials from human to introduce some substance or a drug or a therapy could be considered to enhance or promote that balance of microbiota by introducing healthy microbiota to individuals by what is called probiotics. So probiotics is live microorganisms which, when administered in adequate amounts, they contribute to health of the host, okay? So we are introducing actually here microbiota. How we introduce the probiotics, okay? أكيد تعرفون لبن أكتيفيا مثلا. لبن أكتيفيا يحتوي على probiotic. So it is also included or incorporated in different now dietary products. Now we go to another term, which is prebiotics, not pro, but pre. What is pre now? The pre is not the microorganism, but rather the food or ingredient for that microorganism. So they are non-digestible. It's very important that prebiotics should be non-digestible by the human, because if digestible by the human, they will be no longer useful to be utilized by the microbiota. So it should be non-digestible food ingredients that will beneficially affect the hosts by selectively stimulating the growth of a limited number of bacterial species, which means the microbiota in the colon. Okay, this will improve the health of the host. So now we are introducing food for the microbiota to enhance their growth by what is called prebiotics. So probiotics, you are introducing microbiota. Prebiotics, you are introducing the food to them. Okay, this is the main difference. Like what? Like inulin, for example. And inulin will stimulate the growth and activity of bifidobacteria. Bifidobacteria is one of those useful, beneficial microbiota in a human, in the colon. Okay. Now there is another third term which is called the symbiotics. Well, it is very simple to understand. Symbiotics is just a combination of a synergistically acting pro and prebiotics. Okay, so it is just a combination of the two. Another thing to remember or to know, very important, that there are some requirements for the probiotic strain. You cannot say that you cannot introduce any strain, by the way. There are some criteria there should be present in order to make a probiotic. What are these criteria? First, the microorganism should be a living one, not dead, okay? Because you want to grow, you want to let that organism grow in the stomach, in the intestine. So it should be living. And the other criteria, there should be a minimum effective dose, and this found to be 1 million to 1 billion, okay? So 10 to the power 6 or 10 to the 10 power 9 organisms per day. Okay, this is very important. By the way, you can go to the pharmacy and you can see probiotics there, different types. And there you will read on the label the number of microbiota. Just try it. Go to the pharmacy and just read the label of any probiotic. And by the way, you can administer, you can take some. You can take some. It can change the. If you have some can contribute. We will go to the conditions that can also benefit these conditions. So this is the minimum number. What other criteria? The organism should have a long safety history. You cannot introduce any organism haphazardly. It should be well studied to be safe, and no toxicity, okay, as well. And also very important, they don't show resistance to any antimicrobials. It's very important because they will transfer that resistance gene to the neighbor cell. This will lead to increasing resistance in the future. Will interfere with therapy in the future. So very important. The other things, the organism must resist stomach acidity. That's to say, it should pass the acid barrier. In order to go to the colon, it should pass that barrier in the stomach. And also it should pass the bile and other effects of digestive enzymes also. And finally, this organism must be able to adhere to the intestinal epithelial cells or mucus and colonize. If you introduce everything, everything is fine with a certain strain, but that organism doesn't adhere, then there is no benefit because it cannot colonize. Okay? Now, what are these conditions? Finally, the probiotics shown to be useful in lactose intolerance. So if you have irritable bowel syndrome, inflammatory bowel disease, allergies, Clostridium difficile infection, viral diarrhea, antimicrobial associated diarrhea, traveler's diarrhea, chronic constipation, all these conditions, probiotics can play also beneficial and healthy. So we come to the end of this lecture. Thank you for listening. If you have any question, welcome. So you can ask me questions. Otherwise, the lecture is over, and thank you.